German medical officers, in conjunction with St. Francis Naggalama Hospital in Mukono district, have funded an arthroplasty and trauma camp, which has benefited over 35 patients.
Okay. Next. Yeah.
Dr. Jonathan Ssebugwawo, an orthopaedic surgeon in Naggalama Hospital, says the camp has been running between April 16th to 25th.
We would like to thank the German team, which we are working in collaboration with to put this together. As you know, in Uganda, for you to have a knee surgery or hip replacement surgery, it will cost you between 20 millions and 30 millions. But this team and the hospital have given this service for free. We've also had a collaboration with our surgeons here in Uganda through the Orthopaedic Society of Uganda, has been very supportive in this. We've had Professor Kajja being part of this.
At least 20 patients have had knee and hip replacements, whereas 15 of them had normal bone surgeries, which had developed complications following road accidents.
Doctor Yemulago nangamba ekisule ziki enfu ngamba ekisule enfu kandi yongere yawala ngende ekibuli nendaba dokita wa magumba nangamba naye hajati kikwetagisa sente nyingi okulongoosa amagulu nemugamba sente ngameka nangamba milioni 16 oba 2 kati mubutuufu tegeka milioni aga Nendoza mukalani kange wenaweleze milioni 2 nawo nga wazibu.
Naye ngenza okulaba nga ngenda kutuuka mu kwagula okugulu nga kunnuma nnyo nenzija wano. Naye kale nga ntambudde ebbanga ddene ssente zange zigenze nnyingi. Naye kaakati nensuubira nti nja kufuna obuyambi. Abasawo balungi nnyo, batwagala, balina essanyu, tebatukaluubiridde. Kale buli muntu atwanguyidde abakolamu bonna balungi okutwalira awamu eddwaliro ddungi ne father abatuyitamu kati abatusabira.
Apart from the team from Naggalama Hospital and a group of experts from Germany, the camp also got a boost from Professor Kajja of Makerere University, who is a specialist in hip and knee surgeries.
I would like to thank the Lugazi Diocese for having worked well with the administration of Naggalama Hospital and got in touch with these friends from Germany who have been able to support this camp, this surgical camp, arthroplasty camp. It is a camp which is focusing on joint replacement. So they got in touch with me as one of the joint replacement people who could do joint replacement in our country, and invited me to work with them. We are planning to do up to 20 joint replacements in 1 week, and all the implants have been procured by these friends from Germany, and on average each patient is going to spend, in addition to the hospital supplies and everything that is required for treating these people, it will cost these friends of Germany up to 4,000 United States dollars per patient. That is a total of 80,000 United States dollars in terms of implants and supplies. And we are really delighted to be friendly to these people.
Arthroplasty is a surgical procedure which requires the restoration of a joint by either resurfacing the bones or replacing them with an artificial joint, which is called prosthesis. We have interviewed a number of beneficiaries who count themselves lucky for having been among the chosen few for this camp. Among those is Nicole Nambiru, a student from Mubende district. She has lived with a hip pain since 2000, and each day that passed, her condition kept on deteriorating.
Yesterday, total hip replacement. But before it, I had a noticeable limp. I couldn't hide it, and everyone could ask what's wrong. You know those questions. Yeah, I was always in pain. I was depending on painkillers. I was sizimize mba mbera mbulumu. Kati ekirala nali sikola mirimu egisinga nga ndi almost useless nga sina kyenkola ewaka. So those are some of the challenges I had before the surgery. But after the surgery, I think within a short time I'm able to do everything I wasn't able to do before. And yeah, I don't expect any more pain. I don't expect to take painkillers every day. And I expect to go back to my usual activities. Yes.
Prof. Chiberu is Nambiru's mother, who says her daughter, who is also suffering from sickle cell, had suffered immense pain and that they had moved around different hospitals spending millions of money without a permanent solution.
Kyamazima Nicole tubadde naye ebbanga ddene ng'atawaanyizibwa embeera z'okugulu okwo. In fact okuviira ddala mu 2000 abadde ali mu mbeera ezitali nnungi.
Obuzibu bwava kuki?
Obuzibu bwava shesikira n'afunamu era n'obulwadde obulala kati oleeta ekizibu ekyo nekibanga kyeyongera n'atugyako history y'omwana kale ne bafuna nabo obulumi okusinziira ku mwana engeri gye kyabadde ayitamu tekibadde kyangu. Kati abadde atandise okwebasa oludda lumu sayidi emu nga wano sayidi tesobola kukola ki kugendako abadde yetambuza miggo. Kale twasobola okutuula naye n'atubuulira ki nga bayinza otuyamba naye nga tubadde tustruggling for a period of time tutuuseeko mu bitongole eyo basobole otuyamba twerwanyeeko okufuna ku ssente naye nga tebibadde byangu not until bwe tufunye chance. Twebaza Mukama olw'ekyo, twebaza abasawo, tusuubira nti tujja kuba bulungi okusinziira kuba tubadde tulaba be baakolako bali batya ne tukebera ku intaneti ne tuba nga tucommunicatingira ku bekyali kituuseeko nga nabo batuwa amaanyi. Mazima wabanga millions 25 21 bwe tutyo naye nga Mukama n'atuyamba kyova olaba nti Mukama alina byakola byategeka. Mukama alina byategeka ye alina entegeka ze tekifaananye nga we tubadde ate tuyitira naye nga they could charge us millions 25 27.
Jasper Odankol of 69 years from Padero district says he fell in front of his door whereby he broke his hip and that he has been surviving on painkillers.
I really appreciate the care over here. Compared to other hospitals where I've been, I've seen this one is first class. And I would wish to encourage other people whom I know who need service, hospital service, to consult this hospital. Right from the reception when you reach, the way you are handled, perfect. When you reach the doctor, you attended to. Now that I've been admitted in the ward, you see a different section coming to check on me, counseling me, even prayers. My grandfather was here with his team. I'm a Christian, so I like prayers.
Mike Okudi of Makerere in Gayaza, Wakiso district, suffered a hip dislocation in 2020 when he got an accident. Okudi says the doctors had advised him to do a hip replacement, which was estimated at between 20 to 30 millions.
So I asked him what it means. So the doctor told me the only way it can be cured is by doing a hip replacement. And he told me much about it. A hip replacement involves removing that part that has died out due to limited blood supply. Yeah, and it would involve putting an artificial hip. So he told me there were two methods. There was one called cemented, and then non-cemented hips. So they come at various costs. So I asked him how much the process would cost. So he told me from, I think the cemented one is 20 million, and then the other one ranges from 20 to about 30. So that was 2021. And then he told me, but I would still be moving as I look for the money. It would take some time. He gave me about up to around the end of 2022. That it would take me fairly up to there, then beyond which it can deteriorate and collapse. Yeah, so basically, though the experience has been tough, each day that goes by, the hip keeps deteriorating. Like for example, climbing stairs. You find difficulty climbing stairs. There's a lot of pain. And then like lifting your leg if you want to sit on a border, you can't achieve that. I think, of course, one has to be grateful. Because I see not only me, there are a couple of other people that have been here, other patients. I was talking to some people there, people have taken 12 years with the problem. They've moved to hospitals all over Uganda, just like me. I also tried seeking for opinions from around 3-4 hospitals, but the cost was within the same range. So this is a great opportunity, most especially in Uganda here. You know how hard it is to get 10 million or 20 and put in a hip. It could probably do something else. So it is a great opportunity, and we thank God for this experience. There are a lot of people here. I've seen old people, I've seen people from northern Uganda here doing this. And it is a great experience. We're excited. We're so confident about the doctors. You know, these are people that do these things every day in their country and something like that.
Skovia Picha, a wife of Okudi, says her husband's sickly situation almost cost their marriage, as the breadwinner of the family could no longer fulfill the obligations.
Yes, for anyone who knows about hospital and a sick person, you know it involves a lot of emotions. It is not just the financial, it is every emotion that is involved. Yes, so when my husband got that accident, of course it is terrifying. You're wondering, is it going to be okay? How are we going to go on from here? Yes, all those emotions are in play. But we thank God that we are where we are today. It has not been easy, but we are here. We thank our families, and during that whole process of healing, you know, healing is just not a one-day thing. As a married couple, there are so many things that are in play. Your emotions are in play. The relationship itself, if you're not very steady, there are so many things that can go wrong. Because this person is thinking about himself, thinking about how he's going to get better. You are the wife, you also want attention. You want someone to be there because you've been used to that. You have children who also need you. Like there's so much. The system is really, there's a lot in play. Yeah, but I thank God that we got this opportunity of coming to Naggalama Hospital, where we have really received good people. I was telling my husband that, wow, I've been to hospitals, but this one, everyone is very friendly. Everyone comes and says hello. Like there's a genuine concern for you. It is not about making the money. It is not about what. It is just genuine. They want to see someone get well and get better. We thank God, first of all, for this opportunity that we are able to be among the people who are given the opportunity to get better. We thank the doctors who are visiting, who are working on the patients. We thank you for giving us, should I say, a third chance For us, it is a third chance because Mike has been to hospitals. I think right now he's, should I say, a veteran. He has been there in and out. Yes, we want to thank you because I know he's going to get much better and will go on as well.
Professor Kajja says a big number of Ugandans are suffering from knee and hips complications, though it's only a few who are financially stable that can get the orthoplasty surgeries, which are so expensive.
When I was talking to them, I tried to inquire as to whether they will be coming to our rescue, whether they will be helping us, or whether this was just a one-time off, and they have assured me that they will be coming as and when they are invited and they have got ability to procure those implants because they are quite expensive. But all in all, we are grateful to the sisters and the Gazi Diocese for having got in touch with this group of people. St. Francis Hospital, Naggalama, is one of our mission hospitals in Mukono district, and it is in the Lugazi Diocese. So that is why I talk of the leadership as being good leadership right from the diocese up to the leadership in the hospital. Thank you so much. Continue using our growing facilities.
Dr. Mech Wolfgang from Germany said they do a lot of orthoplasty surgeries in Germany and that they had wanted to respond to the outcry in Uganda.
In charity and bringing everything to this hospital, and for us it's a great experience because we do a lot of arthroplastic surgery and trauma surgery in Germany, and to see here how it works, how we can help and how we can help the people. For us it's amazing to see how this works here, with what things you work here, and for us we live in luxury because we have everything available and at hand, and you have to really do your best to help your patients. So we are happy to be part of this camp.
My name is Sabine Pühl. I'm a theater nurse from Germany. I have started here in this hospital 10 years back, and I have never believed that we will have an orthopedic and a prosthetic camp here at Naggalama Hospital. We have sent a lot of equipment, medical equipment, and in the last containers we have sent orthopedic instruments, a lot, and Dr. Jonathan, he is really happy about it, and he's a very, very good orthopedic trauma surgeon, and he's very happy that he can use all those instruments and equipment for his daily work. And it was a big dream to install a surgical orthopedic trauma camp here at Naggalama Hospital, and dreams are coming true. Now we are here. And I'm here with a super team from Germany. I'm really proud to be a part of this team. And we want to work together with the local team so that we can help and the patients so that they can have a better life.
Sister Mary Ponsian of the Little Sisters of St. Francis Overseas, whose headquarters are at Nkokonjeru, said they conducted this camp as they prepare for the centenary celebrations of the Little Sisters, who were founded in Uganda by Mother Kevin Kani.
Here, as Little Sisters, we care for the marginalized of our society, the poor. So we consider all stages of life. There are those people who cannot afford expensive treatment, and yet, so we try to solicit friends, to get friends from different, from elsewhere to support us, so that our people with this problem of the bones, as the professor has explained, so that they too can be assisted.
My name is Francis Bugembe, a member of St. Francis Naggalama Hospital management team. During this period, we are carrying out an arthroplasty camp, that is surgeries on hip and knee replacements. This is a camp that we have carried out in conjunction and in support from our friends and association with Germany. We want to appreciate our German association members for being part of us and helping to organize everything that we need to assist these patients, most of whom have had these ailments for quite long. Many could not get the surgeries because they are quite expensive, between 20 to 30 million shillings elsewhere, but they have been able to offer all the implants, they have been able to offer all the sundries that are required to ensure that these people get life back. As a mission hospital, it impacts on us to give back to the community, to give back to the people, and during this period, like we have heard from Sister, that the Little Sisters are celebrating 100 years of existence. It is part of all that we need to give back to the community in remembrance of the services of Mother Kevin and the Little Sisters of St. Francis. I want to appreciate